Number one, reducing costs. Is that all right? Save a little extra money? Maybe don't get into bankruptcy? You know, a little something like that. To offer a choice, more than one choice, that includes a strong public option. So here we go. We will reduce the cost. We have a strong public option and a choice. And on top of that, we have access to quality health care for every single person in America today. We have 47 million Americans that are uninsured. Do you know anybody who is uninsured? How many people in the audience are uninsured? Okay, take a look around. Look at your neighbor. If you don't think you know somebody, trust me, you do. I even look at my own family. I have a brother and a sister who do not have access to health care. I'm working on it. And this is troubling. So this is a time for change. And it's all of our responsibility to make it happen. So on this day, September the 2nd, right here in San Francisco, we are all gathered to share our voices to change and reform health care right now. To be able to say thank you to all of our congressional and senator leaders who have been on board supporting President Obama's health care reform plan. We want to give a special shout out and thank you to all of those leaders who've been making things happen. We also want to give a visual that when they're sitting there in Congress making the decision, they see us. Right. They visualize us, all of us around here right now. This is what we want them to hold in their vision when they're making their decision. So we want to make sure that we get that message out. So that's what we're here to talk about today. Now we have a lineup of fabulous speakers for you today, and we're going to get this started. The first speaker for the day is indeed my pleasure.
In America, you have shown it can be done. And when Congress gets back in session right after Labor Day, it's time for them to immediately pass H.R. 3200, the Affordable Health Choices Act. H.R. 3200 embodies two key principles that must be in any health reform that's passed: shared risk and shared responsibility. In the current system we have today, people can be denied health care coverage because they have a pre-existing condition, charged more because they're older, charged more because of their age or their gender. If everybody's in the pool together, if everybody has coverage, we can hold costs down and make health insurance affordable for everybody. H.R. 3200 would create what they're calling an exchange, a pool where people can get health coverage on those principles. People have a wide choice of private health plans in that pool, and they would also have a choice of a public health plan. The public health plan, model like Medicare, keep administrative costs down, keep costs down. The critics are wrong. It won't drive private health insurances out of business, but it will keep them honest. Make them honest for the first time. The second part is shared responsibility. Individuals will be required to have health coverage, and in exchange, subsidies will be available so that low and middle class families can afford to buy health coverage for the first time. Employers will also be required to contribute. And I know that's the piece that's a little controversial. We've got some of the business associations going out and saying you're going to drive people out of business, cost jobs. Well, some of my colleagues just did a study of the law in San Francisco. You know, here employers are required to contribute to health insurance, and we found there was no impact on employment. In fact, the Affordable Health Choices Act is good for small businesses. Small businesses are actually not covered by the requirement. They'll get subsidies. Currently, they pay much more for health insurance than large businesses. Their costs are much more volatile. The Affordable Health Choices Act will open up opportunities for entrepreneurship. People can go out and form small businesses because for the first time, they'll have access to affordable health care. 3200 is good for healthcare. It's good for America. It should be passed now. Thank you.
Yes, we can. Yes, we will. Yes, we did. All right, all right. So a change out right here. Stage shift, stage shift. As we move forward, it's indeed my pleasure to bring to the stage Stanford Williams.
I am fired up. Healthcare. So, reluctantly, I came up here because I love Kennedy. So what I'm going to ask everybody to do, our time is valuable, so please, for my mother and for your losses, I'm going to ask that we very nicely do a 20-second moment of silence for our loved ones, for the hope that we will get healthcare reform so that everyone will be able to go to the doctor.
You know, the Take-It-Easy was kind of working on this healthcare thing for the past 40, 50, 60 years. So it's time for us to make this change. We've invested in this for a very, very, very long time. And there should be no hesitation around passing this healthcare stuff off